And with us is Dr. Robert Fenstermaker, who is the head of neurosurgery at Roswell Park. Doctor, thank you for being here.
My pleasure.
The night that all this broke, we had talked on the phone, and you had said the typical survival rate for glioblastoma is 14 months. Is that correct, in the neighborhood there?
That's correct. That's an average for that disease.
So a very difficult diagnosis.
Yes.
About 10 years ago, you started work on a vaccine called SurVaxM at Roswell Park. Tell us about the vaccine, what it does, and how much promise it's showing.
Well, we realized a long time ago that neurosurgery by itself wasn't going to cure glioblastoma, and so we've been working with immunotherapy, particularly vaccines, to stimulate the immune system to target tumor cells. And SurVaxM is the agent that we've been working on for 10 years and we think has the most promise.
We've talked about this story before in some of our coverage, and the last time was about the first of the year where I believe you had some long-term survival success, 4 or 5 years in that range. Is that right?
That's right. That was what we observed in a phase 1 study that was particularly designed to test the safety, but we did observe that. And so we've gone on to a phase 2 study of many more patients and are seeing good results there as well. And
you've had others join in. I do want to point out the initial phase of this was funded locally. The Alliance, for example, events like Ride for Roswell and that sort of thing got this off the ground, right?
Right. The Roswell Park Alliance, the Ride for Roswell were instrumental in getting this thing going.
And now you've got Dana-Farber, Mass General, Cleveland Clinic, and Beth Israel Deaconess joining in the study, which you continue to run from Roswell Park. I guess the obvious question that many would have is how long until this might be available on a widespread basis?
Well, to make this available and get it approved by the Food and Drug Administration, it's going to take a big study of about 600 patients. So that's probably going to take another 4 to 5 years before it's ready to go out for general use.
But you are looking toward that final phase?
Oh, absolutely. Absolutely.
Doctor, thanks for your time.
My pleasure.